squamous cell carcinoma, which is skin cancer. Today I'm going to share with you information about my biopsy, my diagnosis, my treatment, and my recovery. Thanks for joining today. This is Graciously Gloria. I am not a doctor. I'm just going to share with you today my own personal story with squamous cell and things that I have learned along the way. You can check out my other video, which I have more information about melanoma. So let's jump in. So first off, I had a squamous cell carcinoma about 3.5 years ago. So let me tell you a little bit about that one, and then I'll jump into my most recent diagnosis and surgery. The first one was on my cheek over here, and it appeared as what I would say similar to a pimple. So I thought, people say they can get acne in midlife as your hormones are changing. And I thought initially like, maybe that's just a pimple. Looks like a pimple. Didn't quite, have that ring around that a pimple does, but just had that raised kind of bump. But I was thinking, oh, this is a pimple. But then I put on like benzoyl peroxide. I got some of that. Thought, okay, that's what people put on pimples and it helps them go away. It wasn't going away. And then it became itchy, really itchy. It was driving me crazy how itchy it was. And I thought, I just can't stand this anymore, the itchiness. So I contacted a dermatologist, and I would say actually the first one I contacted seemed booked for quite a while. I ended up contacting another one that my husband had gone to, and I got on the waiting list there for a cancellation to try to get in sooner. So I was able to get in, and when I did, the dermatologist, she looked at it and said, this does look suspicious. And initially I was thinking, oh, she's just going to give me some kind of cream and send me on my way to get rid of this pimple like on my face, right? But she said it may be skin cancer. So she did the biopsy, sent that in. It takes about a week to 2 weeks typically to get your biopsy results. That is kind of stressful waiting to find out what's going on. And this was actually my first skin cancer. So I really didn't know exactly what to expect, but it came back as squamous cell carcinoma. Now there's 3 kinds of skin cancer. There's basal cell, and that one tends to grow very slowly. So the second one is squamous cell carcinoma. Now this one, if it's left, it can tend to grow into deeper layers. So if you wait, your surgery is going to have to be more extensive and going to cause more damage to your skin because it could go into deeper layers, like to the muscle layer, for example. Now, the other thing, it can metastasize as well. So squamous cell can go to things such as the lymph nodes, and then you're going to need some additional other treatment for that, and a surgery to check the lymph nodes, test it. If it comes out that it's in your lymph nodes, then you're going to need additional treatment. The third skin cancer is melanoma. Now, melanoma can travel throughout your body. So it can start off on your skin, but then show up in other areas. It can even travel to things like your bone, lungs, and brain. Now, I have a whole separate video on my melanoma journey, and you can check out for more information there on different key things to look for at your moles that doctors share about melanoma and some other details about my journey. I'll pop the link in for that video. But let's go back to my squamous cell. So this one, like I said, it showed up that I had that, and then they sent me for Mohs surgery to remove it. Now, they did get it all within the surgery, and it has not come back in that same particular area. But now I want to move on, and I'm going to talk a little bit more about details about the Mohs surgery, my most recent one, and this one in particular, how I found this one. I've been going through regular skin checks. So initially when I had the squamous cell, they were doing a full body check every 6 months. Now, when they found the melanoma, they had moved that to every 3 months. And now I was on that for a long time. And now I'm back then to 6 months checkup. So I had a checkup coming up about a month out from when I decided to contact my doctor about this new spot. Let me explain this one. It was right about here. It was an area that looked to me like a freckle initially, right? So not really concerning, didn't look unusual in any way to my eye. And the doctor had seen it before, in my skin checkups, because that's what had been there previously. And they weren't concerned, to that it had changed in some way to indicate a need for a biopsy. But within this window of time, that 6 month window, it had been maybe about 5 months, like I said, since my last skin checkup. I would say this was probably about 2 months ago that I had noticed now at the spot adjacent to the freckle was a dry patch. And I thought that's kind of interesting. Like, why is that little spot right there kind of dry? I put all kinds of different serums and creams on my face, in addition to sunscreen. Super important to put the sunscreen. But I thought, this is strange, it's not going away. But, wishful thinking, I kept thinking, I'm going to just kind of keep putting more serums and maybe this is just going to go away on its own. After about 2 months of time, I thought to myself, you know what? It's not going away. And I probably shouldn't wait a whole extra another month for my skin checkup and just let the dermatologist know, have her look at it and let her determine if it was something to be concerned about or not. So I contacted my dermatologist office. Now, luckily, I was able to get in right away, especially with my history of squamous cell and melanoma. Now, when she looked at the spot, she said, this definitely looks like a pre-cancer acetic keratosis, but I'm going to send it in for a biopsy and let's confirm. So the biopsy took, I would say this time it took around a week for the biopsy. Again, 1 to 2 weeks is typically a time frame that I've received my biopsy results in for. I've had so many different spots biopsied at this point because they always find different ones in my regular skin checkups to biopsy. Now, this one came back, it was interesting because the first squamous cell came back right away, squamous cell carcinoma. This one was a little bit confusing in that it came back acetic keratosis, so that's the pre-cancer, cannot rule out carcinoma. So this kind of indicated to me that it was, if it was as carcinoma, that it was in an earlier stage, but it went from perhaps the pre-cancer to actually they moved on to actually the cancer cells. And I thought, oh, if it is cancer cells, then I'm not happy about that, obviously, but that I thought, oh gosh, I'm going to have another surgery. I'm not happy about that. But I thought, at least they caught it early. And perhaps it could still be that it was just still precancer. So what they did is they scheduled me for a procedure with the surgeon. It's called electrosurgery, I believe. And that one is more involved with like cutting of it off and cauterizing. But when I went to my appointment, in which I found out that is a way that they can treat like an early stage squamous cell. But when my surgeon looked at it, and now mind you, this is the 5th time I've met with him for different surgeries, he's excellent. And he then looked at my biopsy results and looked at my skin as well. And he thought it had probably turned to the squamous cell carcinoma. I then had the Mohs surgery. So let's talk a little bit more about Mohs surgery. I've had 2 of them now on my face. So how it works is you are scheduled for, you really need to plan to be there several hours because it is a longer process. So wear something comfortable. I would say the area tends to be cold because they're going to have a lab on site and then they need to keep it cold is what they told me. So that's why it's going to probably even feel colder than a regular doctor's office in the area. So wear something a little warmer, I would say. And again, plan to be there for several hours. The reason why they decide to do Mohs surgery is because they're trying to preserve as much healthy skin as possible. So they're going to try to take the least amount of skin from you. They need to take the skin that has cancer cells, but leave the healthy skin cells in place. So that's why Mohs surgery is an excellent choice for things like your face. They also tend to do it on things like hands and feet and perhaps lower legs. And you have a surgeon who is well trained on how to do this procedure. You get there, and I would say this time I was just as anxious, perhaps even more anxious than the first time. Now, you would think because I had the procedure before, I would then feel like, okay, I've got this. I know what to expect. But because I remember just how upsetting it was to me, particularly being a woman and having it be on my face and having a scar on my face and, just not only just the cancer diagnosis, but as a woman having a scar on your face, I don't know, it was like traumatizing feeling to me. So just remembering those past feelings kind of brought up those anxious feelings this time around again. But I then was trying to remind myself, on the other hand, that I have a really great surgeon and he knows what he's doing. And it's always better to have a smaller surgery, catch a cancer earlier than later, because later is going to equal more treatment. So here I was in the chair. What they do first is that they numb it and they take a portion out, which they believe then to be the tumor area. And they have a lab on site. And that then takes a while to do. So you're kind of waiting. They put like a little covering, on your face to kind of protect it from any kind of germs. And that might take you like 45 minutes or an hour or so for them now to check that. And they have to cut it. My understanding, again, I'm not the surgeon, but my understanding is that they freeze it and cut it into layers and put dyes to really get a good look at it. And then they look at it in the microscope at the lab on site, and they determine if they got all of the cancer cells and that what they call clear margins, or if they need to come back and get more skin and do that process again, taking more and then looking at the lab. So that can go back and forth depending on how many times you have to have that portion of the procedure done. Now, luckily for me, it was an early carcinoma, so they came back and confirmed to me, yes, squamous cell carcinoma, and we did get clear margins. So that was good news from that respect. But then I needed to wait then for him to be able to come back and do the repair. Now, here's what's interesting about how much they take and the repair. Okay, so I did say they're going to numb it. They numb it, and you don't feel when they're cutting you, because if it's sufficiently numbed. I mean, if you feel something, like raise your hand, say something out loud, like ouch, and so they can numb it more. Okay, so it shouldn't hurt. You shouldn't feel it because it should be numb. And so then what they have to do is they're going to cut like initially like a circle spot, right? Now for the scar to look nice and for it not to pucker, what they end up doing is they take the circle, and I would describe it more almost like a diamond shape then, or a football shape. And they're going to take a circle, and then they're going to take two triangles, one on each side, above and below the circle. And what they explained to me when my first Mohs surgery is that then they take that, and then when they, instead of sealing just a circle, it could pucker out. But now that they have these other shape above and below the circle, it now is going to help it be flatter once it heals. So that's kind of more, feels more traumatic in the sense that they're taking more skin at that time. But then you want it to look good in the end, right? So, I remember when I had the first Mohs surgery, they showed me what it looked like after they had taken all the different skin and before they started the repair stitching process part. Now, this time they showed me just the circle part and not all the extra. Then I was like, I just don't need to see it. Like once you take more, like I don't need to see it, because I don't know, as a woman, again, it makes me want to start to cry when I see it. It just feels very upsetting. Like I said, just is disturbing to see something like that on your face. So, okay, so that was the next step, is then to cut these other areas. And then the surgeon goes into then stitch it up properly, and they decide on what different kinds of stitches. So for example, when I had my melanoma surgery on my back, I have had stitches where they had to come back and have them removed. They can also do dissolvable stitches. So for this one on my face, it was dissolvable stitches. So I don't have to go back to have them remove it. Now you can see that this is a scar right here, and it's puffy, and over time it is going to get flat. I'm about 3 weeks out from my surgery. So if you watch my other videos, the other videos that I posted recently, I filmed prior to my surgery. And so now I'm just starting back because I feel like it's healed to a certain state where I'm wanting to come back and do videos for you all. But I felt like this one was a very important one to start off with. And then I'm going to have, some other fun videos that I'm going to post as well. But this one, I thought I just really want to make sure, if you're going through something like this, that you feel like you're not alone in this, and sharing my experience, I hope, will help encourage others if they have a suspicious spot to get it checked. So I will pop in some different pictures. This is very vulnerable for me to share things like this, but I just want people to feel like they're not alone. And if they go through this, it is kind of traumatizing to see then your face after a surgery. For mine, what happened right after? So, okay, let me back up just a sec. So he did all the proper repair, okay, and he had stitched it, and he, in this case, had me smile so he could make sure he's aligning it properly to how I look when I smile and my cheek. And he's so good and takes that extra time. And I hope that your surgeon does too, to get really good results where they're not only getting the skin cancer, but their scar is going to look good in the end for you as well. Now, what do you do afterwards? So I'm going to then, like I said, I'll share some pictures of what I looked like afterwards. First, this is the picture right after the surgery where they put the pressure bandage. So that pressure bandage, it will look so big. It will look even bigger than what your actual surgery site is. But you're going to have this pressure bandage. And for me, they had me leave that on for 48 hours not to get it wet. So couldn't take a shower then, not wash my face in this area. I just used like more like a micellar water to wash more like this side of the face, to where I wasn't going to get any water on this side because they want it to stay nice and dry. Once then I remove the pressure bandage, I'll show you what that looked like. Then this starts the whole cleaning process. So for the cleaning process, then my doctor had me do a solution of 4 parts water to 1 part white vinegar. And I just put that in a little small Tupperware container, is what I do. And then I dip it, a Q-tip in it, and then I dab it lightly on here. To clean it. So keeping it nice and clean is important. And step 1. Step 2, put on Vaseline or Aquaphor. I'm just a huge fan of Aquaphor. I have it in a larger container. And then I end up, you can use it with your finger, but I just used it with a Q-tip to put on the Aquaphor on there because you want to keep it nice and moist. Now, I know back in the day when I was little, they would say like, oh, if you get a scab, just let it air out and dry out, and that's how you heal it. The more modern way of thinking, and doctors that think that it's best for scar to be minimized, is to keep it nice and moist as it heals. So I would encourage you to do that. I have done that on all my different biopsy spots and my different scar spots from surgeries. Is Aquaphor, huge fan of Aquaphor. So you do that procedure. Now my doctor and your doctor will let you know what their after procedures are, but I'm just sharing with you what my experience and what my doctor had me do. So needed to complete that for 7 days, and putting that on, doing that twice a day is what they wanted me to do. So I did that morning and night for those 7 days. Then after that time, they said it would be okay to go without the dressing. So step 1 was to clean it with a vinegar water solution. Step 2 was to put the Aquaphor, and step 3 was to put a clean bandage over it. Now, this one for me was in an awkward spot because it was near my nose and near my eye. And so I had to actually cut a couple different Band-Aids to fit properly over that. There was one that was a really massive Band-Aid that would have been way too big. And it was kind of like Goldilocks, try to find the right thing, not too small, not too big. What worked for me was taking 2 kind of larger Band-Aids, but then cutting off the excess sticky part of the Band-Aid so it wasn't covering so much into my nose, mouth, or eye area. So that's kind of the cleaning process there. And like I said, my doctor had me do that twice a day for a week, putting the bandage on, and then after that could decide if I want to put the Band-Aid on or not. Now, to be honest with you, I did put the Band-Aid on for a little bit longer because I felt more, I don't know, embarrassed, I guess would be the word, self-conscious maybe, of what it looked like, and wanted to put the Band-Aid over a little longer, just so it wasn't standing out to people, or they weren't asking me what it was. But I thought if anyone did ask me, I would share with them about squamous cell carcinoma, encourage them to get any suspicious spot checked. But okay, back to the whole healing process. Now for me, since it was closer to my eye, they did warn me I could get what's kind of like a black eye. where it's going to be swollen and bruised. And I did get that. I'm going to pop in some pictures for you here. And it was then like a dark purple area here right under my eye. And actually, by the time I would get home, and even when I left the doctor's office, my eye area was starting to swell already and get really like teary eyed and swell. And I mean, I'll share with you, I did cry a little bit at the doctor's office, just seeing it and just realizing, oh, I'm going through this all over again. But then again, I try to temper that with being grateful that it was caught early. So, okay. So then, like I said, over this like first week, I would say initially it was getting worse before it was getting better because it was getting like more bruised, getting swollen. And again, it was like a purplish color and then a yellow color. And I remember my one lower on my face having swelling and bruising. For some reason, I don't remember being as yellow as this one ended up being yellow. I could pop in a photo for you. And again, if you're squeamish about photo, you can fast forward past some of these photos, and I get it. And so anyways, it got yellow, purple, but continued on with my process of cleaning it and the Aquaphor. And then at some point, then you're going to turn the corner where now, instead of getting like more bruised and more, over and more swollen, then it's going to reduce. I would say initially for me, the swelling reduced first, and then the bruising would be next. And I can pop in a photo what it looked like about 2 weeks out. And then you can see what that looks like. Now I'll put in a picture of what mine looked like this morning so you can see it without any makeup or sunscreen on it. Right now I put on a little bit, I've had put my Aquaphor on it still this morning. Then I put on also my St. Jane pore minimizing sunscreen. Love that sunscreen. It's a good primer sunscreen, and then put on foundation. So this is what it looks like there, and you can see the scar here. There are some other guidelines that my doctor gave me. One is for pain to take Tylenol for pain, but not ibuprofen, Advil, or Aleve. And then some other things are to limit activity to allow healing. So no exercise for a week. So that included routine exercise or strenuous activity for 1 week to allow for healing. Other thing is to reduce swelling to keep your head elevated. So what I did is I ended up putting 2 pillows below my head, and it kind of felt weird to like have it more propped up, but I thought it's worth it to reduce the swelling. And then I also like to sleep on my left-hand side, but didn't do that because mine was on the left side of my face. The other thing regarding work, mine said that could return to work the next day unless my work required me to do some kind of lifting above 10 pounds. So that's something that you could talk to your doctor about regarding whatever position you have at work, and if that would be relevant to have more time off depending on that. But I would say the big thing is to reduce, limit that activity. You might want to feel like you want to get back into your exercising, but you do need to allow your body that healing time, and you don't want anything to happen to the stitches coming apart. Some other things that I want to tell you about squamous cell. Just want to give you some kind of like overall things that put you at risk for it, ways it might show up on your skin, and a little bit more about recovery. So a squamous cell can show up things like a scaly dry patch. It can be a raised spot. It could be like a bleeding, oozing kind of spot. It could be itchy spot. So some different things to look for if you notice a new or changing spot on your skin. That again, getting that checked out by a dermatologist, because they can decide then if it should be biopsied and then to go from there. Now, some things that put you at risk for squamous cell carcinoma are things like fair skin, a lot of UV exposure. So perhaps you had more sunburns and did tanning beds. And also maybe you have perhaps skin inflammation like eczema, makes you more prone to squamous cell. Now, for me, what I think that makes me more prone is that I have fair skin, and I definitely had lots of sun exposure, particularly growing up near the beach in California. I love the beach. I still love the beach. I'm always going to love the beach. That's not going to change. And I'm not going to be afraid to go out in the sun. But I would tell you, ever since my first one, about over 3 years ago, I have been diligent about putting sunscreen on my face every single day, even if I'm going to go outside or not, because I fear the UV rays can be coming through my window sitting inside. So, but back to like what I think. So fair skin, and I would say also I was not good about putting sunscreen on when I was younger. As particularly in like the 80s, they were kind of like, oh, everyone should be like the Banda Slate girl, super tan. And I would put like maybe some sunscreen on my body, but I would also even sometimes put like a tanning oil on my body. And a lot of times I wouldn't put anything on my face because I was thinking like, oh, okay, I want to get like, maybe it's going to get a little burn, but then it's going to get, quote, the base tan, and I want my skin to look tan. And so again, if you know better, you do better. At that time, I didn't actually know I was causing so much aging to my skin too by not protecting it, and also causing me to have a higher risk of having skin cancer later. I did know it when I was younger. But now that I know better, I do better. I'm, like I said, much better about putting sunscreen on my face every day. I have a video on different sunscreens that I use and recommend because I have also very sensitive skin. And so some sunscreens do irritate my face. And so you can check that out for some other ideas. I'm also really big on putting on hats. I love a good hat. Right now I'm loving this little bucket hat that I put on a lot of times for my walk, but like a wide brim hat is great too if you're going to be at, for example, in the sun all day, like at a beach all day. But putting on the hat, I also have a video on what I call more than sunscreen, just gives you ideas on other things, like I said, like hats and some protective things, clothing to put on, and just being aware about how UV damage can cause damage to the skin, and that a tan is damage to the skin. So if you're going to tan in any way, I would encourage you not to do a sunbed, and to, if you feel like you need a tan, use those fake tannings. Like these days, they have all those like spray tans and different like cream that changes your skin to a tan. For me, what I've decided personally is just to love the skin I'm in and just let my skin be the shade that it's going to be. And I don't care about a tan anymore like I used to when I was younger. So that's kind of some overall thoughts about squamous cell and some things you can do, like I said, to prevent it. And it does tend to show up in sun exposed areas, especially such as like the face, hands, ears, lip area too. Now, some other things about recovery. So like I said, I'm about 3 weeks out, so it's looking so much better, right? And I did ask the doctor's office, how many weeks do I need to wait to put on my favorite Silogen? So no, I don't work for this company or anything, just a huge fan. And so this is the Silogen, and it is a silicone, and it actually feels very nice on the skin. So initially, when I had my first Mohs surgery, I found out about this product, and it helps in the healing process and helps minimize the scar. So I can pop in the link, the dermatology office that I found that sells it. It's not actually one near my house, but it's one I originally found. So that's where I've reordered it from. The first time, my first one, what I did is I got a day one and a night one. The day Silogen has sunscreen in it and the night one doesn't. And I would use the day one for the daytime and the nighttime for the nighttime. Then I end up, when I ran out of that day one, I decided, you know what, I'll just put on the Silogen and then put sunscreen over it for the day. So I didn't have to have two separate ones. So you can decide, the best way to do that there, but definitely you want to get sunscreen on that face. And the Silogen, like I said, you could use that day and night. They suggest that you use it at least, I think, like a month to 3 months. I'll be honest with you. I use mine for a whole year, twice a day for a whole year. Again, I don't know, maybe it's a little bit of some kind of vanity of caring about my face, but I think my scar has healed so well, this initial one. So it goes like here. So I feel like it really does work. So I'm a huge fan, and I would recommend this. And you can ask your doctor when you're allowed to use it. Like I said, for this one, I can use it after 4 weeks. So I will be doing this twice a day myself. You do want to make sure then after it's healed that you make sure you're putting on the sunscreen each day over your scar. Oh, and that's going to help as well. Now, another thing to note is that when things are starting to heal, I guess the other thing, okay, during surgery, I forgot to mention this. During surgery, one thing that when they're going to do the stitches and all that, you're going to feel a weird pulling sensation, and it shouldn't hurt if they've numbed it properly, but it is a really weird phenomenon to feel like this pulling and tugging of the skin, and it's odd. But you'll get through it. Be brave. Just tell yourself, I can do this. I got it. I got it. Just tell yourself, I got this. I got this. And you'll get through it okay. All right. So now when it's healing, this is the thing that I thought was really interesting. And now I was aware that it could happen this time because it happened after my first Mohs surgery in the healing. I would get what I call like a little zap sting. I would call it almost similar to a bee stinging sensation, almost like I was getting a bee sting, like zip, zap, sting, kind of like a feeling like that. And it might happen like multiple times in a row, could happen throughout the day, just randomly throughout the day. And I remember I initially had called my doctor's office about that, like what is happening? And they told me that's nerves healing, that it actually was a good sign of nerves healing, because sometimes you would initially have numbness, but that the feeling would come back. And sometimes you might have more numbness. You have a continued numbness where the full feeling may not come back, depending. So they said that was a good sign that the nerves were kind of reconnecting, and that was like the zapping feeling. Now for me, they told me it could last a long time. And I'm going to say, for me, that it lasted a lot. Like I would say even 6 months, I felt it a lot. And then even up to almost a whole year, I'd feel it very like even more intermittently from like the 7 months to like a year time frame. It was a lot less, but it wasn't like I never felt it. But I've been feeling that already for this one, like the little zing. And now that it's also close to my eye, I sometimes felt like this pressure kind of underneath my eye as the things were healing, the swelling was healing. It's almost like that pressure. That was a weird phenomenon. And then this zinging feeling I've already started to feel here. I don't know, how long it was going to last for this particular spot, but just wanted to share that experience with you in case that happens to you too. That could also be nerve healing. Always feel free to ask your doctor questions if you're not sure if it's healing the way it should. Now for mine, I have to go back then for a checkup. My stitches the external stitches here have dissolved. That did take, weeks of time to do, but they're going to do, the surgeon's going to do a visual check to see how it's all healing 1 month out. Now, I hope that sharing my story and, being vulnerable and even sharing pictures that you feel like if you're going through something like this, or you have, that you're not alone. Unfortunately, there's many others have gone through this squamous cell. And like I said, I'm very grateful that mine was caught really early and didn't, infiltrate further into my skin, or it didn't travel to things like lymph nodes. And you might have the experience that yours did go further into your system. And I'm, have some sympathy for you to hear about that. If you would like to share your experience with me, and in the comments below, I feel like it's nice to have a good support system. And I hope that you have some people around you that are a good support system. And like I mentioned, you can check out my video about melanoma where I share more information about that. But wanted to be able to share this journey with you, and just to give you some kind of encouragement and just share with you what I learned in the process. And you all take care.